registered by National Drug Authority and licensed by National Drug Authority. Why we do that is because we want our community members to access services from the rightful hands or the people who are qualified under Ministry of Health. So at this moment in time, we urge the public to ensure that they access services to the drug shops that have been licensed by National Drug Authority. But if there is any drug shop which has not been licensed, please, the City Health Officer's office is open. Come and we shall offer you a service. We also say that those drug shops that are going ahead displaying the drugs which are expired, please, we urge the public to be vigilant. If they're selling to the drugs which are expired, they are report and immediately the local authority shall take the necessary measures. We also have drug shop owners who are getting drugs from government facilities and ending up selling them. The drugs which are from the government are written on, not for sale. If you see any tablet which has been sold to you and it's having the issue of not for sale, please just note this drug shop is not meant to be in that the drug is not meant to be in that drug shop, because the drug shops are supposed to go and buy the drugs from the pharmacies so that they can sell unto you. And there should not be drugs of less importance. Let's say maybe you're not supposed to buy drugs which are less than 3 months about to expire. Remember, as you're going to put them in the drug shop, they're going to be, some of them take long to be consumed. Like I've moved certain areas, your drug shops are not busy. So that's why we came up together with National Drug Authority and put measurements that if anyone is coming up with a drug shop, it has to be situated in a busy area, which is about 200 meters apart. When I talk of apart, for instance, if the drug shop is in the middle here, moving to the next drug shop, it has to be 200 meters. Why do we do that? We are trying to create market or to ensure that these drugs that are being sold by the drug shops are consumed in time. That's why you realize that they end up injecting in a lot of money purchasing those drugs, but they expire when they're not consumed, or they end up selling to us expired drugs. That's why we came up with that policy as Minister of Health together with National Drug Authority. So to the viewers, to the listeners, we appeal to you that if there is any drug shop around your area that is admitting, according to National Drug Authority, the drug shops which are under Class C are not supposed to admit any patient. And we are saying if there is any patient you've got who is malaria positive, don't just give the treatment. We are advocating for test and treat policy, because you realize that we are having very many diseases which present similar signs. So if you don't test before you treat, you may not know that you are treating the rightful disease. Therefore, we appeal to the community, to the public to be vigilant so that together we promote good health in our city and our communities. Thank you. We realize that we still have mixed and misconceptions in our communities there. When a person is sick of malaria, malaria has very many strains. There is complicated malaria, there is severe malaria, there is uncomplicated malaria. We realize that those when they're suffering from malaria, they even end up developing cerebral malaria. So if a child has run mad, most of us think like it is not malaria, it is witchcraft. Yet such a child, when is being rushed to the health center, or such an adult, can easily get immediate treatment, care, and get back to normal. So we are appealing to the public to ensure that if there is any sign like nausea, general body weaknesses, headache, fever in a child or an adult, let's rush them to the nearest facility. All government facilities, we are offering free services to the public. We are not charging the patient. That is what makes our community members to get scared of getting to the health centers. The government facilities and the government has equipped our facilities with drugs that are really going to fight against all the conditions or diseases that we are suffering from the community.